So the term peri-appendicular phlegmon, what does that mean? Essentially, peri means associated to, appendicular means in relation to the appendix, and phlegmon comes from the Greek for the term swelling or inflammation. So essentially, it's a swelling or inflammation in relation to the appendix. Hi everyone, my name is Dr. Mohammed Jamal Faisal, and so I'm sure all of you watching today have heard about or know someone who has suffered from appendicitis. But how many of you have heard of an appendicular mass, also known as a peri-appendicular phlegmon? Well, if you haven't, don't worry. I myself hadn't heard of it until I started to see it sort of pop up in some of our past papers while I was in med school. So in this lecture, I'm going to tell you what it is, a little about the clinical presentation, its differentials, and the management with the Oshner-Sharon regimen. And then I'll talk a little bit about the indications for stopping that conservative management. So stick around to know more about a peri-appendicular phlegmon. So to start with, the appendix. It is a little diverticulum or outpouching of variable length. It's usually around 5 to 15 centimeters. And so the base is found at the posterior medial surface of the cecum. The actual position of the appendix can vary. It could be retrocecal, pre-ileal, paracecal, pelvic, post-ileal, or subcecal, as you can see in the presentation. But the site of the base is always constant. Now, the lecture for acute appendicitis is available on the website, so I won't delve into the details of that too much, but the general presentation is migratory abdominal pain that starts in the umbilicus and goes to the right iliac fossa, and it's associated with anorexia, nausea, vomiting, tenderness, rebound tenderness, elevated temperature, and leukocytosis. So an appendicular mass or a peri-appendicular phlegmon is basically a complication of appendicitis. So once appendicitis occurs, it can cause the greater omentum and loops of the small bowel to become adherent to the inflamed or perforated appendix. And essentially this is to wall off the spread of peritoneal contamination, but it can then result in this phlegmonous mass in the right iliac fossa. So the patients will usually present with a history of pain in the right iliac fossa that's associated with anorexia and nausea for a few days. But the difference between this presentation and that of a typical case of appendicitis is that you'll find a mass to be palpable in the right iliac fossa. You'll also find rigidity of the abdominal musculature and tenderness. So that was just a little bit about the peri-appendicular phlegmon. A key point to remember is that the difference between this and regular acute appendicitis is that you will find a mass in the right iliac fossa. And so this is often treated more conservatively than acute appendicitis. So do keep that in mind. We are now going to move on to the differential diagnosis. So do stick around for the next part.